This is an ultrasound study of a 60-year-old female in severe agony, having pain. She is reporting pain in the left region, left lumbar region. However, when I place the probe in the epigastric region in transfer section and bring it down straight in the midline, I come across complex cystic area with internal septations and echogenic area. Now, and then I go down further and I see that it goes up to the region of the right adnexa. As you know, this is the region of the right adnexa where you are seeing the uterus. Now this is the uterus of the female of this patient, and this is the uterine bladder, and this is the cystic area, varying approximately 10 into 7 centimeters, with this echogenic area seen fixed with its lateral wall, from which finger-like projections are seen extending medially within this fluid-filled cystic area. So this cyst is in fact that of pelvic nature, that extends from the region of the right adnexa. This is the uterus, this is the urinary bladder, this black area, and this is the cyst with this echogenic area within it, and this is extend from in the region of the right adnexa, and the patient is very tender to the probe. So this is a complicated cyst extending from the right pelvic region into the up to the above the umbilical region in the midline, and it's now this is the longitudinal section. That was the transfer section. Let's see what is the volume of this cystic area. Sorry. Now this will be the approximate volume, which is approximately 417 ml by measurement. But however, when it's going to be removed or surgical intervention will be done, it will come out to be more than 500 ml. It will not be near 400. So this is the echogenic area within this thin-walled cystic area extending from the region of the right adnexa in the midline, above that extend up to the umbilical region, well, anterior above the umbilical region, and these finger-like projections are seen from this echogenic area, in which few cystic areas are also seen. So this is a cyst with internal echogenic area and right ovarian cyst. With a volume of approximately between 400 to okay. So this is one of the pathologies that is being seen in this patient. Now if you see that this cyst that extends up to interior of the umbilicus. See the configuration. Internal septas within this cyst, and another important thing is that when I give a sweep to the probe, I do not see strong back wall as it should have been seen had it been a totally cystic area. So you see there is no strong back wall seen, or no acoustic enhancement is seen. Now coming back again to the pelvic region, this is the urinary bladder, and now again you will see there is solid mass with the internal echogenic area, and this solid mass measures approximately 8.6 into 7.4 centimeter with a solid densely coarse echogenic non-shadowing area seen along its lateral wall. And this is the mass in the pelvic region of the 60 years old female, and she is postmenopausal. Okay, now let's go for some correlations. This is the urinary bladder. Fine. This is the uterus. This is the uterus. And this is the urinary bladder. This is the longitudinal section of the uterus. Menopausal, postmenopausal. And this is the transverse section. Now in transverse section, it is very much obvious that this solid mass is in fact relating to the is in the region of the right adnexa, confined to the region of the right adnexa, with internal solid echogenic area in it, and this pathology is consistent with 3.5 megahertz transducer through transabdominal approach. There are the possibility of fibroid with internal degenerative changes, multiple tiny calcifications. These are vessels as well as these are tiny vessels, and an echogenic area within it. This appears to be left adnexal echo-filled mass with the solid area within it. This is the solid area, and this is the iliac vessel as a marker for that we are seeing the ovary, because otherwise the left ovary is not visualized in any other location. So one finding is this solid mass, because you don't see I don't see any posterior or acoustic enhancement through this mass. This is the mass, and you see that the posterior wall is clearly seen, no strong back wall is seen, and this portion that you are seeing is that of the uterus in transverse section. So this is the one finding, and echo-filled, either echo-filled cystic mass with solid echogenic areas and a few tiny calcifications. And the second differential for this will be, though rare, but the second will be a fibroid. in the region of the extending into the left adnexa from the left corner of the uterus. This is the uterus, this is the left corner of the uterus, and this is the mass. The other pathology is on the right side. Here you can see now that when I move the probe towards the right side, this is the second pathology. So this is the urinary bladder, this is the uterus, the uterus, if you can see, and this is the other cystic area with internal echogenic having finger-like projection echogenic area in it that extends in the midline up to the umbilical region and then expands towards the right side mainly, having an approximate volume between 400 to 500 ml. So this is the pelvic pathology. We should see that if there is any mass effect, is there any hydronephrosis on the right kidney? What is the status of the kidney? Is there any mass effect on it? In the end, if there is a mass effect, we will see hydronephrosis. Now this is the right kidney. We don't see any mass effect. No hydronephrosis is seen. This is the liver. Any focal lesion in the liver should be evaluated in all such cases. You can see gallbladder. The liver is normal, portal vein, and there is a calculus within the gallbladder. Here you see, this is the calculus measuring approximately 7.7 millimeters seen in the gallbladder. This is the calculus. This is an additional incidental finding, otherwise patient does not complain of any problem in the epigastric region. She has presented only with pain in the left lumbar region. Baji mere pasa le lo. There is no pleural effusion, as you can see that this is the diaphragm, right hemidiaphragm. So mere pasa le. Now we are seeing the left kidney. The left kidney is normal, no hydronephrosis. This is the spleen. We see the right hemidiaphragm, no fluid seen. No fluid seen in the right in the left pleural space. This is the aorta. There is no para-aortic splanadenopathology seen. And coming down, these are the iliac vessels, and there is no regional adenopathy as well. So, as such, no fluid is seen in the pelvic cavity. So there are two findings. So one, a cystic area, thin walled cystic area with echogenic area within it, giving finger-like projections, and the other one is a bit difficult one with this machine, the equipment I am using, either fibroid extending into the region of the left adnexa from the left corner of the uterus, or an echo-filled cystic area with dense echogenic area, solid echogenic area within it. Thank you very much.